Hey, good day and good evening, everyone. It's Tuesday, so here we are again. I hope you are all doing well, and I'm more than happy that you've joined us today. Please let me know if you can hear me properly, and the information from you will help me so we can start. I'm Sophie, and I will be your host today, and it's my pleasure to welcome you all at IVF Webinars by Egg Donation Friends. And as I said, we're here every week with a different topic and great fertility specialists from all over the world. And no matter if you are with us for the first time or second, or you are here with us week by week, we are here for you. And it's our 67th IVF webinars, so it's quite huge source of content available on our website, and you can find it all at eggdonationfriends.com/IVF-webinars. And of course, there will be more. We are just planning next year, and we'd like to ask you for your suggestions about the topics. If you have any ideas, just feel free to write me an email directly. IVF webinars are brought to you with help of our partners, and our partners are Eiselspende, Fertility Clinics Abroad, and Donor Conception Network. And today we are here to meet Theoni Pastroma from Gennima IVF and to know how do embryologists take care of your embryos. Theoni is UK-trained clinical embryologist and embryology lab manager in Gennima IVF, where she works since 2007. Embryologist team at Gennima IVF meet patients personally, as it makes a huge difference that patients fully understand each step of their treatment. And as Theoni says, the embryology lab is not a black box that nobody knows what's inside, and our patients are not just a name, they are familiar faces. So she's the perfect choice to reveal secrets of IVF lab this evening. And we will do that now. Theoni, are you ready to start?
Yes, I'm ready. Thank you.
Yes, so we can do that, fingers crossed, and let's start.
Hi. Good evening, everybody. Thank you, Sophie, for the introduction. Before we take a look into the secret life of the embryologist, we will start with a brief summary of the whole IVF process. The first step of the IVF process is the ovarian stimulation, during which the patient will have to take medication for several days. A small group of follicles will start developing as the patient is taking the medication, and we're monitoring the way the follicles grow, and when by ultrasound scan, and when the follicles reach the right size, then the egg collection takes place. The egg collection happens under sedation, and it lasts about 15 to 20 minutes, depending on the number of the follicles. On the same day that the eggs are collected, they're fertilized using the sperm of the husband, partner, or donor. The eggs and sperm stay in the incubator overnight, and then the next morning we're checking to see how many of them have fertilized. The resulting embryos stay in the incubator 2, 3, or 5 days, and then the best embryos are selected to be put back into the uterus. The whole process is completed with a pregnancy test that takes place exactly 2 weeks after the day of the egg collection. During the whole process, the embryologists play a very important role. We embryologists work at the crossroads between science and patient care that hopefully leads to the birth of a healthy child. This profession involves a wide range of complex responsibilities. So who can be an embryologist? What are the qualities we're looking for? First thing is that the embryologist should possess the skill to perform all the techniques in the lab, starting from the less complicated, like preparation of a sperm sample, to the most advanced, like ICSI and embryo biopsy, that require the use of complex equipment such as lasers, microscopes, micromanipulators. Of course, technical skill needs to be supported by scientific knowledge in order to be able to design and choose the best treatments, and also to be able to troubleshoot if needed. Embryologists should be familiar, and they are responsible for quality control of equipment and materials used. They should be aware of legislation and regulations, and they should make sure they follow them. They should continue their professional development and training in new skills, and they should be team players, both among themselves as well as with doctors, nurses, and midwives. In addition to appropriate education and experience, there are also intangible qualities that an embryologist should have. We work at a microscopic level in 3 dimensions, and therefore excellent hand and eye coordination is very important, and so is manual dexterity. I mean, if you think that the diameter of an egg is about 120 micrometers, and you can only imagine the skill someone should possess in order to handle them. We're also being very careful when we're carrying the dishes containing your embryos, and we even have to be careful about the way our feet are moving around chairs when we walk around the lab. Attention to detail and keen observation are key to our work, and our work involves examination of characteristics of individual cells and embryos that we take detailed records of, and keeping these records and knowing the importance of the information that we're collecting is central to making the right decision for best treatment outcome. Being able to work under pressure and time constraints is also very important, since all the techniques in the lab and all the procedures need to be completely within a specific time frame, which means that we don't get to go home at the end of an 8-hour shift, but we only go home when everything has been completed at the right time and everything is finished and ready for the next day. And last but definitely not least, the embryologist should have the skill to communicate with patients in order to be able to explain every step of the treatment. In our clinic, our embryologists speak to each couple on the day of the egg collection, just before they go home, so that we can explain what we do with their eggs and sperm on that day. We talk to them on the phone the next morning with the fertilization results. Then during the culture of the embryos, we inform them about the development of their embryos, and also we talk to them in person on the day of embryo transfer, where we explain about the quality of the embryos that we're transferring, and we're also giving them the chance to ask any questions that they might have. Despite the education and the skills of embryologists, it is very important to understand that embryology cannot repair embryos, but it can nurture them and help them achieve their maximum potential. Maximum potential can be achieved through a series of steps, starting with careful planning of an individualized treatment. Embryologists collaborate with doctors, nurses, and midwives on a daily basis. We receive information such as the type of stimulation protocol that has been used for each patient, when the egg collection will take place and what time, and the number of follicles that the patient may have. We also collaborate with andrologists and urologists in cases where special requirements about the sperm exist, for example, when testicular biopsy is needed. And we also collaborate with geneticists in case of a genetic or chromosomal problem. We're also reviewing the couple's medical history, previous IVF attempts, and semen analysis reports in order to decide what is the best technique to use for fertilization, whether we're doing ICSI or IVF. What day the embryo transfer will take place, whether it will be day 2, day 3, or day 5, and also how many embryos we're putting back to the patient. Embryologists are also responsible for preparing all relative paperwork. We prepare the lab forms that we use during the whole treatment, where we record all the information we need about the embryos. We're checking the consent forms, and we're making sure they have been signed by the patients and they're in place in their case notes. And we're also checking that the blood tests that are required by law have also been performed. Next step is ensuring a safe environment, which is crucial to embryo culture. Embryologists wear scrubs, hats, clean shoes, and we're washing our hands 100 times a day between handling your embryos. We wear no perfume, no nail varnish. There is no natural light in the lab. The lab is fitted with a specialized filtering system that removes potential toxic components in the air in order to achieve higher quality. Temperature and humidity are also controlled in the lab by a specialized air conditioning system. Working surfaces are all heated in order to avoid exposing the embryos into extreme temperature changes when we're working outside the incubators. We also select embryo tested and non-toxic consumables. I'll make sure that the culture media that we use they're of optimum quality. We do this by making sure we handle them in the right way, which is we keep them in the right temperature in the fridge, and also make sure we don't keep them out for too long when we're preparing the dishes. Finally, we are responsible for the maintenance of the equipment on a regular basis. The aim of creating a safe environment is to reduce the stress the embryos may be experienced while we handle them and culture them outside the womb, because a stress-free embryo is a happy embryo, as I hope you can see in this photo. We even make sure that your embryos get all the nutrients they need to develop. Embryos are grown in special cultured dishes like the ones you see here in the picture. Cultured dishes are set up, that is, they're filled with media at least 6 hours before use. We usually do that the day before we're going to use them. The dishes are set up with appropriate culture media for every step of embryo development, because embryos need different nutrients in different stages. They're placed in incubators at appropriate temperature and gas conditions so that the pH and the temperature of the media are at the right level and the right stage for the embryos to develop in them. And finally, the embryos are moved into appropriate dishes at different stages of development. Once we've ensured a safe environment and safe materials, the work begins. All work is carried out according to strict protocols. All lab procedures are described in detail in writing. The instructions are followed faithfully by all members of the embryology team, which is extremely important. Procedures are all executed within minimum time, because it's very important not to keep the embryos outside the incubators for more than is absolutely necessary. And of course, the protocols are reviewed at regular time intervals for potential improvements. It is important to know that protocols are developed not only with a therapeutic goal in mind, which is to achieve high fertilization rates or blastocyst formation rates, but also with safety in mind in order to avoid any loss or damage to the gametes or embryos. Safety in the lab also includes labeling and witnessing. All tubes, dishes, and straws containing samples, whether they're eggs, sperm, or embryos, are labeled with the patient's names, dates of birth, unique clinic or lab number, or even a barcode. We use printed labels to avoid spelling mistakes. All samples are witnessed by 2 embryologists at different stages of the lab procedures, and also witnessing can be performed by using specialized equipment that is commercially available. After all these steps have been completed, then an embryologist day finally starts working in the lab. The first thing we do, we change into lab wear, that is scrubs, hats, and lab shoes, as I've mentioned before. We're washing our hands and then we enter the lab. The first thing we do is to check that all the equipment is working properly. Most of the work we do takes place at specific time points that, in order to match the timing of oocyte maturity and embryo development. On day 0, the egg collection takes place at 35 hours following triggering, which is the last injection. Semen analysis and preparation takes place within 1 hour of sample production. Fertilization happens at 40 hours following triggering. For IVF, insemination is at 5 hours following egg collection. While for ICSI, the first step, which is the denudation of the oocytes, happens at 4 hours following egg collection, while the injection of the oocytes, which is the actual ICSI procedure, needs to be completed by 40 hours following triggering. The next morning, that is day 1, we check for fertilization, and that happens around 16 to 18 hours post-insemination. And the early cleavage check, which is the first check we do for cell division, takes place around 26 to 28 hours post-ICSI or insemination, respectively. Between day 2 and day 5, embryo development is checked at distinct time points that you can see in the next slide. Okay. As I mentioned before, fertilization check takes place at 17 hours, approximately 17 hours post-insemination. Early cleavage check is at 26 to 28 hours. By 44 hours, we're hoping to see a 4-cell embryo, and then an 8-cell embryo by 68 hours. By day 4, which is approximately 96 hours, we're expecting to see a morula forming. And by day 5, which is 115 to 120 hours, we would hope to see a fully formed and expanded blastocyst. New technologies allow us to take care of your embryos in an even better way. Time-lapse incubators, such as the EmbryoScope Plus that we're using in our lab, allows us to observe your embryos at all times in an undisturbed environment without taking them out of the incubator throughout the full course of culture. These incubators take multiple images of every embryo and they combine them into time-lapse video that provides more information regarding embryo quality. And these incubators are also using advanced software to analyze time-lapse videos of the embryos, and that allows the embryologist to compare the way embryos are developing and to select the best embryos for transfer and freezing. Right, I will now show you a little time-lapse video of an embryo developing from day 1 until day 5. You can see now it's reached the 2-cell stage, the 4-cell stage on day 2 of development. It moves on to become an 8-cell embryo on day 3. The cells are compacting to form a morula on day 4. And then a cavity starts forming and a blastocyst is formed, as you can see in the video. It has been shown that there are clinical benefits of using time-lapse culture and evaluation, and studies have reported improved implantation rates, improved ongoing pregnancy rates, as well as reduced early pregnancy loss. More technology allows us to look after your embryos even when we're not in the lab by using monitoring systems. All critical equipment is fitted with special sensors that take continuous measurements of various parameters such as temperature, pH, CO2 levels, and humidity. And if these parameters are out of range, then alarms will sound, and text messages are sent to the mobile phones of designated lab members. This system also gives us the opportunity to have remote access to equipment online in order to be able to evaluate the problem, and hopefully that will give us time to rush into the embryology lab if anything goes wrong and save the day. Also, in most labs, there are electricity generators that operate automatically in case of a power failure. Finally, we even have an emergency evacuation plan for cryopreserved material in case of natural disaster. Overall, embryologists look after your embryos in many different ways, and through their work, they are in a unique position to impart quality into the whole process of the IVF treatment. In the words of Aristotle, quality is not an act, it is a habit, and this couldn't be more true for embryologists. To conclude, through scientific knowledge, technical proficiency, managerial skill, and acumen, the work of embryologists contributes to what is most important to patients, that is taking a baby home. So thank you everybody for listening, and please remember to keep calm and trust your embryologist. Thank you.
And thank you for taking us into the world of the embryology and embryologists as well. We will now take the questions from the attendees. So I would also ask you, everybody, if you have any questions, just type those questions in the chat section. We will start the Q&A session now. And as we have the first question, we will be ready to go just in a second. Yes. And first will be this one. What is the lowest grade of embryo you would do PGS testing on?
Well, it depends on the day that we would do the biopsy. If it is a J3 embryo, we tend to avoid grade 3 and grade 4 embryos, so we mainly try to biopsy grade 1 and grade 2 embryos, unless the patient doesn't have any of those. So we might try to do a J3 a grade 3 biopsy as well. Now, if it is a day 5 biopsy, then it is very important that it's a full expanded blastocyst with quite a lot of cells, so that we can be able to remove some of the cells. So if it is a blastocyst that is graded as C, both for the inner cell mass and the trophectoderm, then we would probably not try to biopsy that.
Thank you for the answer and the question as well, of course. We will now take a look at the next question. What is the time frame for doing ICSI if doing final in vitro maturation of egg after retrieval? And we have a follow-up comment, next day fertilization. So.
Oh, I see. Right. So if I just may rephrase the question. So if someone has an egg collection and the eggs are not at the right stage to be injected on the day of the collection, how long would you keep them and then inject them? This is how I understand the question. Basically, you would have to check that the next day the eggs have actually matured in culture and they are at the metaphase 2 stage, that is the right stage to be injected. And as soon as you see that, then you should inject them. In general, it is better to do it quicker than leave it for later, because there is a specific time frame that eggs maintain their fertilizing ability.
Thank you for explanation to this question as well. We will now jump to the next one. This will be it. Do potential parents have the opportunity to see their embryos while in the incubator? Thanks.
Well, it is possible with the new technology that we're now using with time-lapse incubators like the EmbryoScope Plus. It is possible to have a look at the embryos. There is an application that the patients can download on the phone, and they can actually have access to their embryos. And it's important to note that they can only see their own embryos, nobody else's. And also, when we do the embryo transfer, we tend to give a little video of the embryos developing to the patients before they go home. So the answer is yes, you can see them.
And thank you for answering this question. We will now take the question. Yes. What is your opinion about artificial intelligence supporting embryologists to evaluate and select the best embryos?
Right. Well, this is a new thing for everybody. It's still developing. It's not widely used in clinical practice yet. Surely it will make our life a little bit easier in the lab. Artificial intelligence means that it's actually from the knowledge of the embryologist that the software will be trained to grade the embryos. So I think in the future it will be a very useful tool for the embryologist to choose the right embryos and hopefully improve pregnancy rates and ongoing pregnancy rates.
And thank you for your opinion on this matter as well. We will have the next question, and the next question will be this one. This question is about embryo grading. What is your opinion on embryos of grade 1AA and 2AB at day 6? Would you freeze these, or are they very poor quality? Also 2AA and 3AA at day 5.
Right. In our lab, usually we freeze embryos on day 5. We don't usually freeze embryos on day 6. And the reason for that is that there are studies that have showed that embryos are a bit slower in their development. There might be problems with their chromosomes. A lot of labs do day 6 freezing, but certainly I would expect embryos to be more advanced on day 6 than 1AA and 2AB. They're a bit slow for day 6. Now, a 2AA and 3AA embryo on day 5, it's acceptable. It depends on the time of the day. If this is in the morning, then it is fine, because you have to remember it all starts with the time that the insemination has taken place. So if you look at them very early in the morning, they might still not be expanded enough. And then if you leave them for a few more hours until midday, then the expansion might be exactly right for you to be able to freeze them.
And thank you for your answer to this question. We will stay for a second longer with the grading, as we have quite relevant question. How would you assess embryos with 5 BC grades? Are they good enough? What about 6 BC?
Right, 5 BC means that the embryo has already started to get out of its outer shell, which is the zona. The first letter of the grading refers to the inner cell mass, which is the part of the embryo that gives the baby if a pregnancy happens, and C is the grade of the trophectoderm, which is the outer cells that will give the placenta if a pregnancy takes place. Now, studies have shown that the grade of the trophectoderm, which is the C in this case, is more important than B. So definitely a 5 BC embryo has the chance to give a pregnancy, and it should be transferred if nothing else, if nothing better is there. And a 6 BC means that the embryo has been completely removed from the zona, like it's now completely out and it doesn't have a zona anymore, which is part of the natural development. They do that. We need them to shed this outer cell so they can implant to the uterus. In general, I would say embryos that keep developing, they should be replaced unless they have stopped developing. We wouldn't cancel an embryo transfer.
And thank you for your explanation and answer to this question. We take a look at the next one. What is the lowest grade embryo that you would transfer fresh?
Like I've said just in the previous question, we would cancel an embryo transfer only if an embryo doesn't develop at all. But it is, we definitely need to be able to see cells, and we definitely need to be able to count cells for us to say that it is okay to transfer. Sometimes while embryos develop and the cells are dividing, they get very fragmented. So if an embryo is very, very fragmented, that means it's probably grade 4, then we would probably suggest not to put it back. But if you can count enough cells, although there are fragments there, if there is no choice of a better quality embryo, we would suggest to transfer it.
And thank you for the answer to this question. We will now take a look at a quite different topic, let's say. How many years of practice would you say that embryologists need to master the process?
Well, there are different opinions, I guess, on that, but the process is very big, so different processes need different time to master. There are no official training programs in many countries around the world. One of the official programs takes place in the UK, and that means that according to the Association of the Clinical Embryologists in the UK, basic training takes from 2 to 4 years. And then for every extra skill that an embryologist acquires, then extra training is required. So for someone to be able to work on their own in the lab by doing the standard procedure like neck collection, sperm preparation, fertilization check, selecting embryos for embryo transfer, they need to work in the lab at least 2 years under supervision. That is, they need to have more experienced people around them. And then for ICSI training and biopsy training, they do need to have extra training, and they should continue their development in order to be fit to do all these processes.
Thank you for explaining this process of the embryologist path. And we have actually a follow-up question, which is this one. Is your clinic giving information about experience of embryology team? Could you choose who is taking care of my embryo?
Well, we can't give the information about the experience of our embryology team. Actually, it's the CVs of the embryology team are on our site, so you can see what training they've had and the education and different conferences that they've taken part in. But you couldn't choose who is taking care of your embryos, because the way the work is carried out in the lab, it means that the whole team is involved in the treatment of every couple. So it's like a rota every day. One embryologist will be looking after the egg collections, someone else will be preparing the sperm samples, someone else will be doing the ICSIs on the day. It doesn't work like one person starts with the egg collection and finishes at embryo transfer, because the workflow wouldn't be easy in this way, and it's not efficient to work like that. So you don't get to choose your embryologist, but you're welcome to meet them and speak to them during the treatment.
For the great question and great answer, and it's also great to hear that teamwork is doing the best here. And we will now take the question related. How critical do you feel the operating room air quality content is to maintaining viable eggs after retrieval before they go into the incubator? I've read that they're finding this is about as important as the air quality content for the embryos.
Yeah, I agree that air quality is very important, as I've mentioned in the presentation as well. I mean, in our lab, the same air handling system that is fitted in the lab is fitted in the operating room as well, so that we maintain the same conditions both in the operating room and in the lab. I mean, surely the eggs are not exposed to the air as much when in the operating room, because they only stay in there for like a few seconds. In fact, they're not really exposed to air in the operating room because they go straight from the ovary into the tube that the follicular fluid is collected, and then this fluid, the tube with the fluid is opened in the lab. So they're not really exposed to the air in the operating room as much. But surely if someone can have the same conditions in the operating room as in the lab, then I think that would be ideal.
Much for the answer to this question, of course, as well. The next question we will take a look at will be this one. Some clinics have not embryoscope and they use the classical methods. Does it reduce the qualities of the embryos and the chances of success?
Well, most clinics around the world don't have an embryoscope yet. If I remember correctly, about 20% of treatments around the world happen using the embryoscope class at the moment. Classical method has worked for years, and it does still work. It doesn't reduce the quality of the embryos. Embryos have got their own dynamics, and like I said in the presentation, the way you look after them can help them maximize their potential. The difference between the classical method and the time-lapse incubator is that you have to take the embryos out of the incubator in order to check them and grade them, and that means that you expose them to lab air. So what you need to do is to make sure all your working surfaces are heated, the air quality is good, and you have to be quick when you're doing all these procedures in order to return them back into a safe environment of the incubator, and hopefully they'll be fine. I mean, we are using a combination of both the classical method and the time-lapse incubators, so they are safe to use and have been used for years, and most clinics still use them. So if used properly, this shouldn't reduce your chances of success.
Thank you for showing us this picture and the answer to this question, of course, as well. Yes, and we will have the next one. Before the transfer, in case of more frozen embryos, would one or more embryos be unfrozen? And when can you tell which one to transfer?
I'm sorry, let me read this once more. Well, it depends. The number of embryos we thaw depends on the number of embryos we want to transfer, and also depends on the stage where the embryos have been frozen. I mean, for example, in our clinic, sometimes we freeze embryos on day one, which is just the prenuclear stage. It's only fertilized egg, and in these cases, then we recommend that more than one embryos are thawed out, because you don't know exactly the way they're going to develop. So if someone has more embryos, we suggest that more of them are thawed and cultured, so we can choose the best out of them. But if they're frozen at the blastocyst stage, then it depends on how many we need to transfer. If we're only transferring one, then one embryo is enough to thaw out, and then we check it again the next morning to see if it has survived during the night and it's re-expanded, and then we can transfer it. In case this embryo doesn't make it through the night and the patient has another one, then there is enough time to thaw another embryo in the morning and transfer the other one. That will be better.
Huge thank you for your answer to this question. We will take the next question, and actually this will be also the final call for the questions. So if anybody has questions and waited till now, yeah, don't be shy, just ask questions. And type those questions in the chat section, take one by one and answer those, but this will be also the final call for doing that. Next questions here, but I need to find the one which I just lost. Yes, I have it. Do you think that watching your embryo development is really increasing chances of getting pregnant? One clinic in Spain is claiming that it increased by 10% chances.
Right. It's not actually just watching the embryo. What happens in the time-lapse incubator is that because the embryo is staying in the incubator at all times, their environment remains stable, and that means that they're not stressed and they're happier, like I said before. So we don't disturb them, and that gives them a better chance to develop because their environment is stable. By collecting all these images and by analyzing the videos, we have the chance to examine characteristics of the embryos that we couldn't do before when we were just taking snapshots of their quality. And that gives more information about the way they're developing, because studies have shown it's not only the stage of the embryo that is important, but it's also the rate at which the embryo reaches that stage, and also the time between the different cell divisions. That is very important. And yes, there have been studies that have reported increased to pregnancy rates as high as 10%. That is correct.
Yes, and this will be, I think, additional question because I think, yes, and we have follow-up comment that it may also be connected with psychological impact. Sorry, I forgot to add, watching on the phone by us patients. So,
okay.
From the other perspective. So this will be like additional question to the previous one, because you said from the embryologist perspective. And
right. Yeah. Well, I mean, it depends on the patient and the couple on what they feel that they should do. I mean, some people might be very interested in watching exactly how the embryos are developing, and someone else may feel that this is very stressful for them or very emotional. At the moment, we don't offer the patients this option in our clinic, but I think sometimes having too much information might actually be a bit confusing and very stressful for patients. I think it's important to know how to judge about the value of the information you get, because for embryologists, cell divisions and timings do have a meaning, because this is what we do every day. But for a patient, it might be very, very stressful to watch them because they don't actually know what they're doing. So I guess it depends on the couple and its personal perspective of every patient.
Thank you for these two questions and two answers and double perspective on this one as well. We have the next question on the list, and this question will be this one. When we have a teratospermia with 2% normal sperm, Is the fertilization rate with ICSI good?
Well, it actually depends on the rest of the parameters of the sperm as well, because if you have quite a lot of sperm to work with, for example, you have, even if it's a few million, then the actual number of the sperm that is normal is quite a lot. I don't know if you can understand. What I mean is that you have 5 million of sperm swimming and 2% of them are normal, then the absolute number of the normal sperm is quite a lot. So by looking at the sample, you will probably be able to find some sperm of normal morphology to use for your ICSI. Overall, if the quality of the sperm is very low, the fertilization rate with ICSI is not as good as it would be if the sample was better.
And thank you for your explanation to this question. And the next question we will take a closer look will be this one. Do you have any general recommendation about how to improve the embryo transfer process on the day itself?
I'm guessing this means from the patient perspective. Is it possible to have a comment on this, please, Sophie? Is it what can the patients do to improve the chances? Is that what the question is?
Yes, I think so. That's what you can do to improve the embryo transfer process on the day of the transfer, right? So what the patient can do, yes, to improve the chances.
Really?
Yes, exactly. We have the final comment. So just to be sure that.
Right. Excellent. Thank you. Well, the truth is that once the embryos are put back to the womb, there is not a lot that you can do. What we usually recommend is that maybe for 2 or 3 days, you know, you're a bit more relaxed, even maybe stay home, but not in bed. Just try to avoid things that stress you out. But really, there is not something that you can do specifically to help your embryos implant, apart from being very careful with the medication that you need to take until your pregnancy test.
Yes, and thank you for this question and the answer. The next one will be this one. Can we improve the chances of success by transferring fresh and frozen embryos? Has this been done, or is it always one or the other?
Well, I mean, we do, sometimes we do combine fresh and frozen embryos. For example, if someone has got one frozen embryo in storage and then they go through a second cycle and they end up with one more embryo, then it is possible to combine the two and put them back during the same embryo transfer. It's not always the one or the other, at least not in Greece. Maybe in some countries there might be regulations that suggest that it should be the one or the other, but that is probably just for monitoring purposes of the success rates after the different techniques.
And thank you for this question and your answer. Yes, the next question we will ask you will be this one. Some companies transfer embryos and spermatozoa from one clinic to another in the same country or between two different countries. Does it influence the quality of gametes and embryos?
Right. The companies that are transferring embryos and sperm between clinics or countries are usually certified companies, so they have the appropriate training to carry biological material, and they have to be certified for this. So if the sperm or the embryos or the eggs are transferred in the right drawers or containers, and all the regulations are followed, then that shouldn't influence the quality of the gametes and embryos. They should be absolutely safe to arrive to their destination.
And thank you for this explanation to this question as well. And someone is typing, so we will take a second and wait. Is it a question or is it just a shout out? Although I will, of course, show you some of the shout outs. Great presentation and thank you.
Thank you.
Thank you one more time for all the knowledge and for your answers to those questions. And yes, it was actually also one very similar thank you.
Thank you very much.
So yes, we have one more question, which is actually more to me. So I will as well publish this one. The link to the webinars, which are available on our website, as well as to this one, which we are watching now. I will put the link in the chat section, and you can find it all at eggdonationfriends.com/IVF-webinars. Yes, I can see that we don't have any more questions. And just as I said it, we have one more. So we will take it, right?
Right, of course, yes.
When you answered the question about fresh or frozen, you did not say if the chances are better with fresh or frozen, in your opinion. What are your thoughts, please?
Right. I think there are more than one questions here. Now, if you combine fresh and frozen, that doesn't make your chances better. I mean, your embryos will do what they're supposed to do. But if the question is actually, are fresh better than frozen or the other way around, frozen embryo transfers these days do very well. The results are comparable to fresh embryo transfers because the freezing techniques, which is vitrification mainly these days, they're so much improved than they used to be in the previous years, and therefore the results from frozen embryo transfers are comparable to fresh embryos transfers.
Thank you for answering this question as well. And we have one more coming up, so it will be this one, although, yeah, this is very similar. So if you have any additional comment, are the implantation success rates of a fresh embryo that with a frozen embryo? So comparable, I think.
Yeah, if the frozen embryo survives the freezing and thawing process and it continues to develop, then it should do exactly the same that it would do when if it was transferred as a fresh embryo. So if everything goes well with freezing and thawing, then the success rates should be similar.
Thank you for this question and your quick answer as well. We will take a look at the next one, which will be, I think, probably the final. Does the transport of frozen embryos between two countries in Europe influence their quality? Frozen air transport.
Right. Like I've mentioned before, if this transfer is done by qualified companies that are certified to transfer biological materials and all the rules and regulations are followed, then the quality of the embryo shouldn't be affected by this transfer. Embryos are transferred in liquid nitrogen, and that should keep them safe if everything goes to plan.
Yes, and thank you for this explanation as well. Okay, we have a few more thank yous for you. So you can be sure that it was very helpful and informative.
That's good to know. Thank you.
Today, this evening. So yes, we can continue with that without stops. But we will be then finishing our today IVF webinars, and it was, of course, great pleasure to have you all here. So thank you, Theoni, for your time, for your knowledge, for your professional opinions, and thank you everybody for being here with us today.
Thank you for having me.
And do you have any final comment? You would like to add anything? You can do that now.
I just wanted to say thank you for having me and for all the interesting questions that I had the chance to answer. And it's really good to see that patients are very interested in what we do in the lab. Because most of the time we spend our day in a little box, and we don't get to see patients too much, which is why in our clinic we try to have as much as patient contact as we can. So it was great having the chance to talk to you.
And it was indeed great to have you here this evening, and thank you one more time for that. You can, of course, find our today IVF webinars on our website. As I promised, I put the link to the website in the chat section, eggdonationfriends.com/IVF-webinars. This is the place where you can find it. And please follow us on our social media, because you will be always up to date, and follow Gennima IVF. They have also a great content there. So yes, we will be honored if you would like to stay with us. We have also something new coming up, and it's actually taking place tomorrow. It will be IVF webinars in German, so feel free to join the webinar tomorrow. And of course, it will be great pleasure to have you all back here next week and the next week and the next week, and it will be great if you will be back and join us next time. Huge thank you for today. Have a great night. Have a great day wherever you are. Thank you, Theoni, one more time, and Gennima IVF. And yes, it will be a wrap for today. Bye.
Bye. Thank you.